Hello, my name is Rohina Malik. I am an optometrist and public health advocate. I feel that my purpose in life is to build a better world by prioritizing self-care, choosing love over fear, courage over silence, and connection over division, and in doing so, creating spaces and systems where health becomes a human right. Dr. Stephanie Kirschbaum believed in bringing clinicians into communities to experience the human connection behind care. She showed that lasting change happens through action, partnership, and commitment. I carry that forward. Her legacy lives on in every community we serve, every story we hear, and every life we touch. This is what living and practicing with purpose looks like. So at 27 years old, I unexpectedly became a patient. As a young doctor entering this world, I had blood clots in my lungs and my brain that forced me into a hospital bed. The experience truly shaped how I practice medicine. I realized every single patient that we encounter and see is always carrying an invisible story. Health equity just stopped being like a buzzword for me. It truly became something that I felt every single day. Every single person in this world, no matter who we are, our race, color, gender, orientation, it is truly our job to be there for the patient. One of the experiences that kind of shaped who I am as well, kind of aligns with this promise I made to myself, was kind of seen by Colleen, a Special Olympics athlete. So Colleen's story taught me the power of listening. Colleen shared a story with me where when she came to Opening Eyes, the Special Olympics vision screening event, she was saying that she went from doctor to doctor, appointment to appointment, had complaints of having difficulty to see the TV, she had difficulty doing her hobbies like knitting, reading. Each time she went to the doctor, they kept saying, "We don't really see that." So with that, I sent her to a neuro-ophthalmologist. We actually follow up with the athlete to see what exactly happened, how they feel. She ended up being seen and found out that she has ocular myasthenia gravis. She just kind of said on the phone to me, she's like, thank you so much for listening and helping me. I never realized I would miss these simple things without my vision. You actually took the time to listen. Just sitting there and hearing that reminded me exactly why I do what I do. That lesson of listening, guiding, and advocating carried into my next experience with Prevent Blindness.
So New Jersey Commission for the Blind immediately approved coverage. Once I got approval from them, I was able to order her the lenses that gave her life-changing vision improvement. And now she's 20/20. I had a patient referred to me for scleral lenses. It's very expensive. It's not covered by medical insurance in many cases. You don't have to be a low vision provider to provide this service.
Now that I hear it, it's I already had the roadmap. I think that's the beauty of joining organizations or talking to one another. It's to inspire and create action. As a patient and a doctor, we're kind of going through the same struggle to kind of help them get care. Conversations like this and being curious and seeing what we can do that will truly create long-lasting impact. One of the programs I was actually part of was VSP's Future Leaders Academy. It was a beautiful program that I truly loved, and I learned so much, not only about myself and my potential, but also the work of what others do in optometry. Parker Family Health serves thousands of uninsured patients across New Jersey, providing comprehensive care regardless of ability to pay. Partnering with Parker, the Fabro Foundation, and the New Jersey Society of Optometric Physicians, we established an eye care space within their clinic. Our shared goal: ensure patients receive examinations, corrective lenses, and follow-up care embedded within a trusted medical home. So through Eyes for Hope, we want to host annual vision clinic events at Parker, predictable, ongoing care for uninsured patients. This isn't a one-time event, it's infrastructure. Parker provides trusted relationships and integrated care, and we provide resources and support. Together, we're creating a sustainable model that continues beyond our involvement, building systems that serve patients even when we step out of the room.
Parker Family Healthcare patients come to us for chronic disease management, their physicals, vaccinations, eye care, specialty care, especially in areas of cardiology, nephrology, neurology, oncology, orthopedics, 14 different specialties, including also mental health.
I started here as a volunteer. I love that we work as a team truly, and the passion to help the people in the community. Over 150 volunteers. We've had kids that, were failing their class, and all they needed was a pair of glasses. People are working at their jobs and they can't see what they're doing. They can't do it efficiently. Imagine how exhausting that is.
We have a lot of volunteers that will see patients outside the facility for free. You avoid going to a hospital, to an ER, to spend hours waiting for somebody to sometimes just send you home and don't do anything. I'm the office manager. I've been here over 25 years. I get up every day and then I said, who am I going to help today?
I started as a volunteer, coming once a week. I absolutely love the staff. I love the doctor. I love the patients. I would encourage every volunteer that comes to us that you are going to feel so gratified working with our patients. You're special. You've done special work. You showed up. You made a difference.
My mom used to come here. Yeah. She passed now, but she used to come here for diabetes. You know, when they start helping my mom, I realized how important is this place. Actually, my daughter, when she wasn't working, she used to come here, but now she's working and she has insurance. And it's all these co-payments, all that stuff, and say, Mom, can I go back to the clinic? And say, no, you have insurance now.
My dad got to see the very first patient, and he knew Dr. Cheslock, and Dr. Cheslock asked him if he wanted to volunteer. So he was the first volunteer ever. I had a nephew, and he became a board member. He became co-chair here. So I got involved, and then I became a volunteer. We have all these programs. We run a food program. We have an outreach program. We do a sneaker drive. We're always giving things away to people, and we're so lucky just connecting people with what they need. Kids need glasses. Yeah. You could bring your kid in and have their eyes tested for free. Yeah. I think that's awesome.
Free of charge. When we first opened, a lady came to me and she said, Dr. Parker took care of me and my children for the duration of the Second World War. This is Dr. Parker Sr. And he said, your husband's service is payment enough for me. That spirit flowed through to the initiation of this place. The imparting of their name to this center meant it's going to happen even while they're gone. That spirit is alive here because of them. This is a real deal. Yeah. This isn't smoke. This is fire. Yeah. This is fire. Come on over and see it.